final session, or actually like the closing session of the Sixth Digital Health Society Summit. Today's behind us. And I always say this is like Christmas. We are waiting for it a long time, the whole year. And then suddenly it's done. Those 2 days were filled with lots of fantastic content, lots of discussions, keynotes, case studies, discussions. I think we learned a lot. The topic of this summit was how we modernize healthcare, how we make sure that healthcare can actually catch up on the other sectors when it comes to digitalization, how we can scale up the digital innovations, the digital solutions to benefit healthcare. And we were looking into 5 years future. And Mladen, what were your some key takeaways that you take with you after those 2 days?
Carolina, thank you. And I can't help but make the first remark about the last session on women's health. What a fantastic panel. Those people who know me know that I have been championing women's health for the last couple of years. And it's just brilliant to see the quality of that discussion and the positive impact I think we are beginning to have in terms of raising the profile of women's health. So my thoughts start with some fantastic chat and engagement in the chat or by the attendees, people commenting, people connecting and starting collaborations. And after all, that's one of the aims of the ECH Alliance, to join the dots, connect people, encourage collaboration. But there's 3 things I really want to pick up from today. One is data. And in that context, we heard some interesting remarks about the need for a data culture. A number of people emphasizing the importance of health data for things like safety, planning services, improving quality, innovation and testing, using that data. And then a very interesting discussion about the balance between public interest and personal privacy, and what data for what purpose. And then again, a balance between data for public and industry business models. And then transparency and the importance of data in a learning health system. So secondly, people. And it was fascinating to hear Alkan describe what matters most to patients. And then hearing about inequality and equity and literacy. Fantastic to see 14 speakers from different countries of the world. And then in that last session, an emphasis on being humble and being open to learning. And then thirdly, and finally from me, a little bit about attendance. So it's fantastic to have 1,300 attendees from 112 countries. Truly the ECH Alliance as a global health connector in practice. A very interesting variety of subjects covered, and some fantastically able speakers and experts. If anyone is out there and they think that they have a topic that we didn't cover, or that they'd like to see us cover next year, please reach out to us. We are always open to suggestions. And then finally from me, thanks to all of the speakers, all of you, the attendees, and also our team who behind the scenes make this summit possible. And that's too many people to mention. They know who they are. And both Carolina and I are very grateful for all your hard work. Thank you.
Thank you so much, Mladen. And yeah, I agree with your points. And of course, I'm joining you in thanking our team, our partners, our speaker, our sponsor for the support. For me, I would say that yesterday we started the summit with the presentations from Estonia, and one of the speaker was talking about like building the house and having healthy foundations, and I think that this metaphor stayed with me during those 2 days, and I was just like trying to see what elements of this healthy foundations and healthy house are, and having this metaphor as for healthy healthcare system that can actually embrace innovations, embrace digital solutions, and benefit from them in a most in the best way. And I have here that, of course, we need to have vision, we need to have investment, we need to have skills. And today, I think we are adding, of course, we have to have a good data, good quality data. And I agree that the last panel on women's health, I think that this is call to action again for all of us to take this issue seriously, to join the cause, to champion women's health, because this is in everybody's interest. But also, like, still coming back to this house, and you said about people, it's obvious that, of course, in the center of this house, even if we have healthy foundations, healthy vision, and so on, we need to make sure that there is a person, people, patient, citizen feeling comfortable there. So it's in the center of our attention. I would finish here. I think we learned a lot, and we have some ideas how to improve the situation in the healthcare system, and we will, of course, report on that. And for all of us watching today, be ensured that all the recordings from the sessions will be posted during November on our YouTube channel, ECH Alliance YouTube channel. You can subscribe to our channel now. There is lots of different content, lots of different sessions, webinars from our events around the globe. And yes, indeed, we organize this as the Digital Health Society Summit virtual event. And I'm sure that we also have the edition in 2025 in mind already. And we will announce the dates shortly, but also we have lots of different in-person events in Europe and in the US, also joining in India. And you've heard about our participation in the events in Africa. So please follow us on social media and subscribe to our newsletter to stay in touch, to stay informed, and not miss an opportunity to connect with our members, ecosystems, and experts, and of course our fantastic international team. So thanks from me, and yeah, see you until next time.
Thank you all. Goodbye.
Goodbye.